AAOS real exam questions. ND correct answers // already grade DA+. Clinical signs of compensated shock include all of the following except A. Cool and clammy skin. B. Absent peripheral pulse. C. Restlessness or anxiety. D. Rapid, shallow breathing. Answer: absent peripheral pulse. Pulmonary edema and impaired ventilation occur during A. Anaphylactic shock. B. Cardiogenic shock. C. Hypovolemic shock. D. Neurogenic shock. Answer: B. Cardiogenic shock. Basic life support, BLS, is defined as A. Invasive emergency medical interventions, such as intravenous therapy and advanced airway management. B. Any form of emergency medical treatment that is performed by advanced EMTs, paramedics, physicians, and D. Emergency nurses. C. Basic life-saving that is performed by bystanders while EMS are en route to the scene of an emergency. D. Non-invasive emergency care that is used to treat conditions such as airway obstruction, respiratory arrest, and cardiac arrest. Answer: D. Non-invasive emergency care that is used to treat conditions such as airway obstruction, respiratory arrest, and cardiac arrest. You are performing mouth-to-mask ventilations with oxygen connected and set at a flow rate of 15 L/min. What percentage of oxygen is your patient receiving? Select 1. A. 45%. B. 55%. C. 65%. D. 75%. Answer: B. 55%. 1/4. Online medical control requires ______. A. Written protocols approved by medical control. B. Phone or radio contact with medical director. C. Presence of an advanced level provider. D. A physician's presence on the scene of the call. Answer: B. Phone or radio contact with medical director. What should an EMT do to limit errors in the field? A. Carry an EMT test for reference at all times. B. Deviate from established standards when necessary. C. Follow the agency's written protocols. D. Contact medical direction before initiating any treatments. Answer: C. Follow the agency's written protocols. You are caring for a driver who struck a light pole. SHE admits to drinking alcohol, but orders you not to tell anyone. You should report the information to ___________. A. The receiving nurse or doctor. B. Law enforcement personnel. C. The state motor vehicle department. D. Your medical director. Answer: A. The receiving nurse or doctor. You are encouraging a patient to go to the hospital by ambulance. You know that a transport will keep you on duty several hours after your regular quitting time. This is an example of A. Undue hardship. B. Patient advocacy. C. Scope of practice. D. Abuse of authority. Answer: B. Patient advocacy. The ability to understand others and have them understand you is known as ________. A. Communication. 2/4. B. Scene leaderships. C. Self-confidence. D. Teamwork and diplomacy. Answer: A. Communication. The EMT's first priority is A. Personal safety. B. Rapid response. C. Treatment and transport. D. Empathy for all patients. Answer: A. Personal safety. Common factors that influence how a patient reacts to the stress of an illness or injury include all of the following except A. Assessment by the EMT. B. Mental disorders. C. History of chronic disease. D. Fear of medical personnel. Answer: A. Assessment by the EMT. Which of the following is an EFF active stress management strategy? A. Frequently reflecting on troublesome calls. B. Requesting overtime to occupy your mind. C. Modestly increasing caffeine consumption. D. Developing a social network outside of EMS. Answer D. Developing a social network outside of EMS. Which of the following statements regarding the different stages of the grieving process is correct? A. The grieving process typically begins with severe depression. B. It is rare that people will jump back and forth between stages. C. The stag ES of grieving process may occur simultaneously. D. Bargaining is the most unpleasant stage of the grieving process. Answer C. The stages of grieving process may occur simultaneously. 3/4. The simplest yet most effective method of preventing the spread of an infectious disease to A. Undergo an annual physical examination. B. Ensure that your immunizations are up to date. C. Wash your hands in between patient contacts. D. Undergo annual testing for tuberculosis and hepatitis. Answer C. Wash your hands in between patient contacts. As an EMT, you may be authorized to administer aspirin to a patient with chest pain based on A. The patient's condition. B. Medical Director AP Proval. C. An order from the paramedic. D. The transport time to the hospital. Answer B. Medical Director approval. Upon arriving at the scene of a motor vehicle crash, you note that two small cars collided head-on. The occupants are still in their vehicle S. The fire department is in the process of stabilizing the vehicles, and law enforcement personnel are directing traffic. After parking the ambulance at a safe distance, you and your partner should A. Quickly begin the triage process. B. Assist with vehicle stabilization. C. Report to the incident commander. D. Put on high-visibility safety vests. Answer D. Put on high-visibility safety vests. Which of the following scenarios most accurately depicts a post-traumatic stress disorder? A. An EMT with many years of field experience becomes irritable with her coworkers and experiences headaches and insomnia. B. A newly certified EMT becomes extremely nauseated and diaphoretic at the scene of an incident involving grotesque injuries. C. An EMT is emotionally exhausted and depressed after a school bus crash involving critical injuries and several deaths of several children powered by TCPDF, www.tcpdf.org. 4/4.